Vaccine diplomacy's getting fraught.
Any suggestion that I in any way made any criticism of the European Union yesterday would be completely incorrect. I'm grateful.
Scott Morrison on the offensive over the supply of the AstraZeneca vaccine from Europe.
3.1 million of the contracted vaccines did not turn up in Australia. That is just a simple fact.
A simple fact the Europeans seem to dispute.
There was only one request which had been refused, but for much smaller quantities.
That was for 250,000 doses, and the first public sign that the AstraZeneca contract with Australia might face some European turbulence.
If you're not approving, it's the same as effectively you're blocking.
That obviously had a very significant impact.
Not that the government would admit it at the time.
We are very clear that this does not affect the pace of the rollout.
It's always about shifting blame to someone else.
But with the EU claiming publicly it's not blocking exports, the PM's demanding the original contract with AstraZeneca be respected. Promising 1 million doses would immediately be dispatched to PNG, where a COVID crisis is mounting.
If that doesn't occur, then we have been working with a number of other partners around the world.
The government's made vaccine delivery its #1 priority. It raised expectations, offering benchmarks on its performance, only to then be less than transparent about the retreat from its own ambitious vaccine targets, which has invited criticism and put ever more pressure on local supply.
There is nothing that is not being allocated to be put in an arm. That's to be absolutely clear. There is nothing sitting in a cupboard.
There are hopes that CSL's Melbourne factory will eventually pump out 1 million doses a week of the AstraZeneca jab. But what doses it does produce won't go straight into arms until every batch is checked. The World Health Organization having a fresh look at possible links between blood clots and the AstraZeneca vaccine.
We are confident that the benefits-risk assessment for the vaccine is largely still positive.
Given Australia's reliance on this particular vaccine, may that remain the case. Andrew Probyn, ABC News, Canberra.